This is hematological cancers, and our first hematological cancer that we are focusing on is leukemia. Now, leukemia is a type of cancer disorder affecting the blood, bone marrow, lymph system, and the spleen. And unfortunately, it affects all ages of people. It is related to the loss of the regulation in cell division, and we know that cancer happens when cells just keep multiplying and don't respond to signals that keep them in equilibrium. We know that there's an interplay of genetic factors. There's no single cause to leukemia. There's an interplay of genetic and environmental factors. The DNA of the cell becomes mutated, and abnormal genes called oncogenes start taking over. Environmental factors that may be associated with leukemia include chemical agents such as benzene, which is found in gasoline, and formaldehyde. Chemotherapy drugs, specifically alkylating agents, are also associated with leukemia. So these chemotherapy drugs that are used to treat cancer are actually also cancer-causing. Alkylating agents were one of the first classes of chemo drugs used back in the 1940s to treat cancers. Radiation is another associated cause to leukemia. Exposure to high levels of radiation, nuclear disasters that cause radiation exposure, and also people that are treated with radiation, again for cancer many times. And viruses are also associated, specifically the human T-cell leukemia virus type 1. They've found a connection with this virus to the development of leukemia in some populations in Japan and the Caribbean. So we classify leukemia on whether it is an acute or chronic onset, and that helps us kind of determine the treatment of the course of treatment. In acute leukemia, there's a rapid onset of immature hemopoietic cells, and they keep replicating and cloning. In chronic leukemia, there's a gradual, steady kind of onset involving more of a mature type of white blood cell. And there are 4 types of leukemia. There are 2 that are acute and 2 that are chronic, and we'll get into these specific classes here. One other part of the classification system for leukemia is the type of white blood cell that is involved. So this is the origin of the white blood cell. It is either a myoblast or a lymphocytic type of blood cell. Myeloblasts are the precursor cell to granulocytes, and lymphocytic cells are the precursor to T and B lymphocytes. So those, you want to understand what type of white blood cell is involved as well. That is how we identify the 4 major types of leukemia, and this also affects how we treat the specific leukemia types. So we have acute lymphocytic leukemia, or ALL, acute myelogenous leukemia, or AML, chronic lymphocytic leukemia, CLL, and then chronic myelogenous leukemia is CML. So those are your 4 types of leukemia. Now, as a review, this is just showing maturity of cells and how that works. They all start off as a stem cell, and then they start branching into specific types of blood cells. You have the lymphoid stem cells, the myeloid stem cells, erythroblasts, and the megakaryoblast. So they all develop into specific things, and this is just showing you that to help understand how immature cells develop into more specific mature cells. So you can see the lymphoid blasts turn into B lymphocytes and T lymphocytes. The myeloid blasts turn into monocytes and granulocytes. And that's where we are focusing our attention for leukemia. So acute lymphocytic leukemia, ALL, is the most common type that is found in children, and the peak ages for this leukemia is 2 to 5 years of age for diagnosis. This type can also occur in adults over the age of 50. This leukemia happens when immature B-cell lymphocytes proliferate in the bone marrow. So they're rapidly growing in the bone marrow. And the majority of patients will have a quick onset of a fever, and that's one of the initial signs of illness and is many times found at diagnosis. Some patients will also show quick onset of bleeding tendencies, so they start having issues with bleeding and bruising and that sort of thing. And others, the onset of this illness is more nebulous and unclear, with signs and symptoms of weakness, fatigue. They can have joint and bone pain, and they can also have bleeding tendencies that take longer to develop. One common feature of ALL is the development of CNS complications, and this is an indication that there has been invasion of those immature cells into the arachnoid tissue of the brain. This can cause an increased ICP. It can cause nausea, vomiting, and lethargy in those patients. So that is something specific to ALL. Acute myelogenous leukemia, or AML, is also called acute non-lymphoblastic anemia, so you might hear that. AML makes up approximately 80% of all acute leukemias in adults, and the incidence is more common in adults over the age of 60. Onset is very abrupt, with signs and symptoms of bleeding and infection, and the illness is from uncontrolled growth of those myeloblasts, and those are your immature granulocytes. Other signs and symptoms that can be found are fatigue, weakness, headache, mouth sores, and anemia, and that's showing kind of those systems that are being impacted by the immature growth of those myeloblasts. All right, chronic myelogenous leukemia is another type of leukemia, CML. It's found in older adults. It's a rare type of leukemia in children. And the development of CML is from mature neoplastic granulocytes that are located in the bone marrow. These cells can move into the blood flow and invade the spleen and liver, and they cause damage to these organs because of that invasion. The illness begins as a chronic illness with no real symptoms initially, and this can last several years and be controlled with treatment. But despite treatment efforts, the illness will eventually progress into a more acute phase called the blastic phase. And it's at this point that the treatment becomes more aggressive, similarly to the acute forms of leukemia. There has been a genetic component identified in CML. The Philadelphia chromosome is a translocation that happens and creates a protein that is actually interfering in regulation of cell growth. Excuse me. So because of that chromosome, there's a problem in regulation of cell growth. And the specific chromosome has been found in about 90 to 95% of those patients diagnosed with CML. It is not specific to CML. It's actually found in other patients with AML and ALL types of leukemia. Chronic lymphocytic leukemia, CLL, is our last type of leukemia. CLL is the most common leukemia of adults. There's an increased incidence found in older adults over the age of 65, especially in men. It's predominant in men. In CLL, there is a buildup of mature but inactive and small lymphocytes, commonly the B cell lymphocytes. They invade the bone marrow, spleen, and liver, and there's also lymph node involvement with this type. CLL many times has no symptoms initially, but the patients may experience chronic fatigue, anorexia, and splenomegaly. Enlarged lymph nodes, when there is that enlarged lymph node development, this causes pressure on nerves, and as the disease progresses, this can cause pain and paralysis to the patients. Lymph node enlargement in the mediastinal nodes can also affect the lungs and cause some pulmonary complications. And there are also some other kind of more rare types of leukemia, and sometimes we are unable to identify what cell is causing the type of leukemia. So these ones can be very hard to treat and many times are associated with a poor prognosis. And we're not really going to talk anymore about those, but I really want you to focus on the 4 main types of leukemia. Here is a pathophys chart from your book, just to show you how different areas are affected by leukemia. So you have the proliferation of white blood cells occurring, and they're going into the bone marrow, causing bone marrow failure. They're infiltrating sites outside of the bone marrow, the central nervous system, the lymph nodes, the liver, the spleen, the joints. So there's other involvement there. And so it shows you kind of what you would expect to see with that involvement. So those manifestations are related to the bone marrow problems and the invasion to other organs. The bone marrow is overrun by these abnormal cells, and they're wreaking havoc, and they're causing inadequate production of normal marrow cells. And then these abnormal cells keep accumulating because they don't follow the same rules of programmed cell death that is happening in normal life cycle of a cell. And that invasion to other organs is causing splenomegaly, hepatomegaly, lymphadenopathy, bone pain, CNS effects, mouth sores, and lesions as well. The diagnosis of leukemia is based on a blood test to check levels of those blood cells. They will do a complete blood count, CBC, and this is going to include the hemoglobin, the hematocrit, and total RBC counts, which is the number of circulating RBCs in the blood. And also RBC morphology, which is showing the shape and size of the RBCs. This will also give the white blood cell count and differential of the white blood cells. The CBC gives you the platelet count. And in leukemia, you will see anemia, you'll see thrombocytopenia. The white blood cells, they can actually be normal, increased, or decreased, depending on which type of leukemia and what is happening, what stage of illness the person is in. If there is a high number of white blood cells in the circulation, over 100,000 cells per microliter, this can cause the blood to be very thick and start causing blockages in the circulation, and this will lead to infarctions. They may aspirate and do a biopsy on that fluid that is aspirated. The bone marrow biopsy is a definitive test for leukemia and will help with the classifications of leukemia to determine that. So treatment modalities include chemotherapy. It's the typical treatment for cancer. It acts on all the rapidly dividing cells, both normal and cancerous, and there are different stages of chemotherapy that are used to reach specific goals. So induction is the first stage. This is the initial treatment that is aggressive in destroying cells in the tissues, in the blood, and the bone marrow. And this is the time when the patient becomes very sick many times from the chemotherapy, and they will have severe bone marrow suppression. So they will show neutropenia, thrombocytopenia, and anemia. Intensification therapy is a high-dose therapy that is used right after induction therapy ends, and this can last for several months. Consolidation therapy begins after remission has been established. There may be a few more courses of treatment given to the patient to eliminate any other possible cells, and higher doses are used again for this part of chemotherapy. Maintenance therapy is the treatment with lower doses of the same chemo drugs that were used earlier on. And these are given every 3 to 4 weeks to keep the body free of those leukemic cells, those immature cells, and the problematic cells. The chemo drugs used vary based on the type of leukemia that has been diagnosed. And the best treatment regimen is one with a combination of drugs to reduce resistance and reduce drug toxicity by using drugs with different levels of drug toxicity, and then also to use drugs that will stop the cell growth in different phases of the cell life cycle. So they will do this combination type therapy to help with that. We'll talk more about chemotherapy later on as we talk more about complications related to all hematologic cancers. So other care for leukemia will include the use of steroids and radiation treatments. Radiation can be directed towards specific organs that are affected by the leukemia. Cranial radiation may also be used in patients that have CNS involvement of ALL. Biologic therapies may also be used to treat leukemia. These use the immune system to create an environment that is unfavorable to cancer cells. They do this by boosting up the immune system or by manipulating the immune system in some way. Some examples include the cytokines, the monoclonal antibodies, and vaccines are also used as biological therapies. And the last one is hematopoietic stem cell transplantation. So this would be like a bone marrow transplant. This can also be used as a treatment option for leukemia to bring in normal cells into the bone marrow, and you can have use of a donor type of stem cell or the patient's own stem cells used in this situation to try and get normal cells to be produced in the bone marrow.